Are you someone who suffers with HS? Have you tried steroids? Have you tried spirolactone, but yet you're left with scars and flare-ups? One of the best treatments for you to try would be laser hair removal. It kind of prevents the flare-ups because it reduces the amount of times that you shave, which shaving can increase your likelihood to get flare-ups, but also the laser itself helps with the scars. It helps take down the color of the scars and the actual cell buildup of the scars. So you can really, if you do about 6 to 8 treatments, calm down on the inflammation. Some people like to say that HS is actually self-induced, that it's manifested, and I just want to say that's absolutely not true. I treat people with HS every single day. It is actually an immune disorder. It has immunity deficiency properties to it. It is not something that someone can wish on themselves or create in their own mind. It is not induced by depression or anxiety. It is something that the body kind of does. And it affects a lot of people. It doesn't matter your weight, it doesn't matter your age, it doesn't matter your skin color. So I really want to help spread the truth about HS, and this is something that affects people every single day. You may not know it. They may not share it with you. It will affect their underarms, their groin area, their butt area, their thighs. They are dealing with severe scars and swelling, inflammation, pain. And a lot of dermatologists don't necessarily know how to treat HS. So it's something that does affect a lot of people. I would say there are a few things that you could do to help with some of the irritation from HS. And it is something that can go away on its own, but it's also something that you can live with for a very long time. Because it is triggered by elevated cortisol levels, you could do a few things. You could practice yoga, you could try and meditate, you can try and reduce your stress levels, but it is not directly caused. I will say is zinc will be your best friend always, always. Whether it's Desitin or if it's just straight zinc that you can buy at CVS or Rite Aid, it's something that will calm down the inflammation. It's something that will soothe the skin. Definitely do not try, putting alcohol on it or anything like that, because that's just going to irritate the skin a little bit. Definitely use Desitin or zinc oxide as much as you can to help just kind of calm down that area. Now, if you have a primary care doctor or you see a dermatologist, try getting on Humira. They're injections. It's something that is expensive, but if you have insurance, I'm sure that some of the companies actually provide rebates and different things with Humira. That would be a really good option if you can get it. Another option, if you have insurance, would be like a steroid injection to help kind of calm it down, cut it out. That's an option. Those injections are called Kenalog injections. There is something called clindamycin, which is an antibacterial gel that can help. I've seen it help sometimes. I'm not going to say all the time, but it is helpful. So if you can get access to some medications, certainly try your best to. Some things I like to tell patients that I know with HS, definitely keep a 10% benzoyl peroxide wash on you if you can. You can order that on Amazon, or you can go to the pharmacy. If you can't go to a pharmacy, you can certainly find it. I know I have some in my office as well. That's always your best bet. I would also say HipaCleanse will always be your best bet and your best friend. I use HipaCleanse just for a normal cut. I think it's very effective, it's inexpensive, and you know that it's going to clean any bacteria in the area. And I would rather you use a HipaCleanse opposed to an alcohol or a Now, if you're suffering pain, Tylenol is always key, and you always want to rotate your Tylenol every 4 to 6 hours if you can, especially if you have a current flare-up, which they can be very, very painful. Also, Tylenol will help calm down the inflammation. So I would say take, you know, a 200 milligram every 4 to 6 hours to help with that. I think that if you want to look for band-aids or bandages, that's probably the best bet. I wouldn't say get anything like a liquid bandage or anything like that. Try and get like a gauze that kind of is a little more webby. Don't get like the impacted gauze, because you don't want to cover up any flare-ups that's trying to ooze itself out. Also, if you do get bandages, just make sure that you change those bandages very often. I would even probably change once every hour to 2 hours. You don't want it to stay on, because bacteria breeds if it's in a place that's closed up and warm. So let's say you have flare-ups on your groin or your underarm or your butt. You don't want to keep a bandage on for a long period of time, because that breeds bacteria, and the body loves nothing more than to produce bacteria. So just don't do it. It's not safe. So that's kind of my recommendations for bandages. Definitely keep it light. Change often. If you're gonna do pain medicine, definitely Tylenol every 4 to 6 hours. And again, I think that your best bet would be to try and cut back on the shaving. So laser hair removal would be great for you. Even laser genesis to help on the scarring. Definitely no microneedling. I know that it may be tempting to do so because they are hard scars, and you might think that microneedling might kind of even it out, and in theory, yes, it would. But because it's HS and because there could just be some things brewing, I want to say that there is no shame in this disease. Do not let anyone shame you. If you do have HS, do not keep it to yourself. Don't think that it'll go away on its own. Definitely seek out help from a primary care doctor, a dermatologist. Definitely tell your parents if you're young. And if you're an adult, I would say definitely know that it's a road that you'll have to kind of adjust your life for. I always tell patients to kind of keep a little care kit in their car, just in case of anything. It's good to maybe have some HIPAA in a little bag, some gauze, some bandages, and some Tylenol, just in case you do kind of have a flare-up out of nowhere. Keep an extra pair of underwear. Keep some leggings or some sweatpants in the car as well, because if you do have a flare-up, the last thing you want to do is have on tight clothing. You kind of want to keep your clothing very loose fitting, very comfortable. And then of course it's just the waiting game. You're trying to kind of wait out the HS, see how long the flare-up is, and then it'll calm itself down. So try to just reduce your stress as much as you can, and you will get through it. If you have any questions, let me know.